Good morning, and I'm excited to jump in and learn a little bit more about what you're doing. But if you don't mind, just start with giving everyone just a brief background on yourself, and we'll
Sure.
kind of jump in from there.
Yeah, sure. First of all, I wanted to say thank you for inviting me to the HITLAB Innovators Summit. And it's really been great listening to a lot of the speakers here. And I think we have a great presentations and opportunity to really learn from the really experienced and very diverse set of speakers and participants. So it's been great being part of this. In terms of my background, I'm a primary care physician in terms of my training, internist, and in my terms of my current position, I've been working as Associate Chief Medical Executive for Lovell Federal Healthcare Center, which is a joint VA DoD facility. So we take care of veterans as well as the Navy recruits and active duty and their dependents. So it's kind of a unique integrated system, federal healthcare center. And I've worked at the Department of Veteran Affairs for over 15 years, and previously served as a CMO and also worked in private sector previously as well. I think it's been really great to see a lot of the digital health innovations happening in the VA as well as in the private sector. But that's kind of my background. So hope to discuss some of the things that we're doing here in the federal healthcare sector.
Oh, that's great. Thank you so much for that background. Well, we'll just jump into the first question, which is very relevant to the background that you have. But share a little bit about your experience regarding telehealth care for veterans and what's happening there.
So I think VA has really embraced the use of telehealth over the last several years. We have three main modalities, kind of categories, I would say, when it comes to telehealth. One is and we put them together under the umbrella of connected care services. So we have the VHA telehealth, which is the main delivery of the telehealth services, and this includes various types of modalities like clinical video telehealth, which is uh, having the veteran joined by traditional telehealth, which is they may be at a location remotely and then they're connecting to the tertiary care facility using clinical video telehealth terminal. And then we have the VVC, this is the video connect, where the patients can connect from their home or anywhere to their physician or their healthcare team. And then we also have store and forward technology, which is sort of like you take images like in dermatology, and then those are forwarded to a specialist. So those are kind of the three modalities. And then we also have mobile health, which is a use of a lot of applications that the patients use for care, and their veteran application. They could be provider application as well. That's under category of mobile VA mobile health. And then we also have the My Healthy Vet, which is more of a patient portal to communicate, do messaging, instant messaging, as well as getting appointments set up, and also having the patients have access to their health records. So those are kind of some of the things. And we have certainly been in a rapid expansion of telehealth services within the VA. And, we have provided over 2.2 million telehealth episodes of care over the last few years. And we've really seen a rapid expansion of uses of various modalities of telehealth, especially during COVID.
Yeah, that's all. That's awesome. There's definitely been a lot of opportunity over the last couple of years. We hear the word digital divide. Can you talk to us about what that means and how that kind of plays into this?
Yeah, so our goal in the VA and our health center is really to provide care, not only, to provide care to all the veterans or all the patients, which means including the patients who don't have ready access to technology, uh, also reaching the underprivileged and low-income veterans, rural veterans. So our goal is really to have health equity, and it means reaching a wider population of our patients, ensuring that everybody has access to technology and digital health. So while majority of the population, has access to the internet and computers, smartphones, we still have a significant population which don't have that access. And I estimate from the Federal Communication Commission is 15% of the veteran households do not have internet connection. And you see some of the data, there's a wider disparity in some of the population, like in rural area, low income households, also some of the minority populations. So while we have overall rapid advances, there are segments of population kind of left behind.
Well, and I think you've covered this, so that's basically how you can care for those. But does that digital divide mainly affect rural areas?
I would say certainly, yes, rural areas have a higher number of patients, and in our case, veterans who don't have access uh, to the internet connection, or they may not have broadband access, like for data. And when they did, there was a research article from a couple of years back, which found they looked at the penetration of the internet, and urban areas like 80, 70, 80, 89% versus 75% for the internet penetration for rural areas. And only about, when we did a survey, only about 50% of the patients that actually had access to internet, in the rural areas, which is much lower than a lot of the urban areas. And also, we have a lot of low-income patients, certainly, and many of them live in rural areas. They also are a significant proportion of those who don't have access. And I think the big part of the in rural is really broadband access. Even though they may have basic phone services, they may not have the broadband services. And there is certainly a lot of initiatives going on right now through various federal agencies to expand the availability of broadband internet in rural areas, especially.
Do you think there's more that we can do to meet the patient expectations, or specifically in those rural areas?
Yes, certainly, there, one of the things is to really making sure when you offer these services, you have to check with the patients that they can actually access them, and that's very important. Uh, so I'll just talk about some of the things that we're doing here in the Department of Veteran Affairs to kind of bridge the, what I would say, like bridge the digital divide, so to speak. And I don't know, you may have additional questions, but I kind of jump into this. Basically, one of the things we have is that we have a digital divide consult. So which means if you a provider feels that they're going to offer, or the healthcare team feels they can offer the digital health, like telehealth, but there is some barriers, they can put a digital health consult, and the patient or veteran will be connected with a social worker who will assess their situation, and then we actually provide them assistance. We have programs where we can connect them to make these devices available. So for example, we have a VA internet connected device that we are making available to low income and rural veterans. And we are actually loaning out iPads to veterans who don't have access. And VA has already spent over, like, we have given out over 10,000 iPads, and spent several $1 million on this initiative. We're still trying to fine tune the process here, but that is one of the one of the ways we are trying to help with the patients, but I can talk about some additional things as well.
Yeah, that's really exciting and great to see all the work that's being done there. I think I just have my own question around this too, if you don't mind, is
Sure.
around the outcomes and how have what kind of success have you seen? What would have been some of the results of those efforts?
Yeah, I think the biggest thing is really we have seen a much rapid increase in use of virtual care appointments.
Mhm.
Uh, that has been the biggest impact. We are since we launched this, I would say, we have seen a thousand-fold increase in the video appointments, and we have provided 1.1 million tele-mental health visits to over
Mhm.
350,000 veterans just past year. So I think and we have provided 9 million additional virtual care interactions this year compared to last year. So I think this has been a very rapid increase in the adoption of our virtual care. But we want to make sure that we don't have patients who are left behind, because we do hear from our stakeholders, and we want to ensure that the technology is reaching out to everyone.
That's great. It's so great to hear that impact with such a important, such important members and patients that's such a great impact that you're making. Um, so we've got just a couple more minutes here, but
Sure.
if you want to just offer any advice or wisdom based off of your learnings and the work that you've been doing, what advice do you have for everyone?
Yeah, I think main advice I would say is really as there's a lot of opportunity, certainly in innovation that we are doing, and we have an opportunity to really make care better for our patients. And with the use of technology, especially with chronic disease management, managing a lot of mental health illnesses and so forth. But we want to make sure that we are also taking into consideration our uh, uh, vulnerable patients. In our case, a lot of elderly veterans, rural veterans, as well as under low-income veterans or patients who don't have access to the same technology. So we want to make sure, and there are a lot of resources available through federal agencies and various other uh, funding sources. So we should make use of those resources which are available to get the patients connected with them. And for example, I would just say another initiative it's called the Atlas Initiative. We are partnering with private sector and public uh, 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 agencies such as American Legion, Walmart, VFW, to actually uh, connect these rural veterans to telehealth. So they can actually go to their local VFW office or Walmart store, Walmart store, and then have access points from there. They can kind of connect it. So we have to look at more innovative ways where we can connect these patients to the services. So that's what one of the suggestions I have, is really finding ways how we can connect these patients to services that we have.